Hello, this is Julie Russell with my presentation for the final week 1, for the overall view of the chapters. Week 1 is describing the role of the healthcare manager. Describe the contributing factors in the healthcare management. The differences between healthcare management and other management fields, and the differences between clinical and non-clinical, and describing patients to staff ratio, and define profit margins. The healthcare manager's role is assuming leadership and management responsibility for multiple units and departments. The measured implement is used to provide effective care based on patients to staff ratio. Contributing factors in healthcare management: understanding of how the legal, political, and economical climate is used. The difference between healthcare and other management fields is that healthcare managers are expected to help manage processes that are not directly tied, but may be indirectly tied to measurable outcome. Difference between clinical and non-clinical. Clinical is physicians, nurses, therapists, or medical assistants. Non-clinical is billing, transcriptions, hospital administration, or research. Impact on measurement healthcare quality and set the number of patients to staff for providing care. The changes depend on the level of care being given. Profit margins is measured by the cost of products and the return on the investments. Week 1, still we're talking about management technology, managers and communications, and employees. Management and the importance of a manager is in healthcare. Management technology consists of a wide range of hardware, software solutions created to enhance managers' performance in their key functions. Managers need to communicate with employees to show their policies and procedures. Planning is another step to involve employee productivity, which includes collecting data and arranging and analyzing the roles of the employees to make sure the work is getting done. Week 2, summarization of insurance, overtime, billing, fee for service and capitation, outsourcing, and quality measures and pay for performance. We learned about insurance differences, the types of insurance from PPO, HMO, PSO, Medicare, and Medicaid. Learning the why we have overtime and what it is important to have to cover for people off or more people needed for more patients. Medical coding as a medical billing may appear to be large and completed, but it's actually a process that consists of 8 simple steps to follow. Registration, establishment of financial responsibility for the visit, patient check-in and out, checking for coding and billing completion, preparing and transmitting claims, monitoring payer adjustments, generating patient statements or bills, and assigning patient payments and arranging collections. Fee for service is for physicians and is said to provide incentives Fee for services for physician is assigned to provide incentives. Capitalization is per members for basic steps to provide for payments. Outsourcing is when companies decide to try services for other outsources to save benefits and employees. They will outsource different employees to save. And quality measures and pay for performance is a performance evaluation on the hospital to see how they rate. Still expanding on week 2, we're talking about capitalization, which are payments that are usually used by managed care organizations to control healthcare costs. Capitalization is a fixed amount of money per patient per unit of time paid in advance to physicians for delivery and healthcare services provided to them. Money is paid depending on the services provided and the number of patients involved and the time services that are provided. When primary care providers sign a capitalization agreement, they will have some specific services they will provide. The number will be determined in the number of services provided and vary per health care cost. Some might include prevention, diagnosis, and treatment services, injections, immunizations, medications, administrations in the office, other outpatient laboratories, tests done either in their office or a designated lab area. Some healthcare education and counseling service performed in the office and routine vision and hearing screenings too. On to week 3. Week 3 we learned about supply chain, FIFO versus LIFO, and tracking supplies. Supply chains are important and need to be tracked and have inventory done on them to see what needs to be ordered and what is being used the most and reordered. FIFO is first in, first out, and LIFO is last in, first out, are two inventory management systems that are used to track the ordering system. Tracking supplies is very important in the healthcare industry. You don't want to be missing anything when a patient is having a procedure and you need it now. These systems are used to track and reorder supplies when they are low, or use one thing more than the other to see if you should order more. This process is very important during a patient's procedure. Nothing should be in the way when having a procedure stop for not having supplies. Week 4, we learned about quality and safety, accreditation, federal state insurance systems, financial systems, and data. Quality and safety is a major focus on how well results are collected on data from patients and what is needed to improve on. Accreditation is very important, and when accreditations are expired, they could not be paid by insurance or covered to work in their facility. Federal state insurance accreditation should include evidence-based evaluations that verify 13 specific criteria. All information to support the following 13 criteria should be primary source verified with 120 days. System needs to be put in place to verify the accreditation is correct and collection for the system's file. The system will make sure the accreditations are up to date and will let them know if someone's not renewed. The financial system on the organization gather data and see how different departments are needed. The data is collected to obtain information and help important decision-making processes. Accreditation and data. Ensuring the accreditation of the doctor and facility in the state where we are working in. Why accreditation is important and why you should be accredited. Being credentialed with insurance plans means that you are able to see patients with specific insurance plans and bill those insurance companies for a series of services you render. This will help a doctor increase the patients they see. Data helps the completion of the chain. We collect the data from patients and departments and receive information that is needed, and the knowledge is used to complete what is needed for the patients or the departments. Week 5, we learned human resources, family leave, family labor, equal employment opportunity commission, employee retirement income security, and workers' compensation. Human resources is word to help the employees with issues on their rights. Employers can get Family Leave Act after 12 months work period, and they get 12 weeks without pay unless they have time off. Fair labor is making sure you get fair wages and our law to make sure everyone is treated fairly. Although the FLSA was put in place to help workers, the protection is attempted to provide all limited and flawed. The EEOC came in play in 1965 for employees that were age discrimination, disability, and civil acts right. The IRIS was made to make sure that employees had retirement plan or pensions or something in play with their companies they worked for. We will see if this stays years from now, since companies are going away from pensions, but will offer 401 plan where the company puts a percentage into it. Workers' compensation is when an employee gets hurt on the job and they will receive benefits, or if they can't return, they will get a disability with workers' compensation to pay while they can't work due to the injury done at work. The case has to prove it was done at work, and they can receive what they need to return to work or do a different job with the same pay or difference in pay. Benefits, workers' compensation, claims and injuries, and return to work. Workers' compensation is insurance that provides employees cash benefits and medical care for workers who are injured or ill from direct result of the job they are in. Workers' compensation is paid to employers, and employees are not required to contribute towards the cost of compensation. If a claim is made, the claim goes directly to the Workers' Compensation Board. The board will then determine if the workers' compensation claim is true work-related injury. A claim is paid if the employer or insurance carrier agrees that the injury or illness was related. The worker can return to work, but injury prevents them from returning to the job. They have a lower job and entitles them to any benefits that will make up for 2/3 of the difference. Employers that have less than 5 workers do not need workers' compensation covered. Other than workers not covered are farmers or sole proprietors can opt out of the coverage. Week 6, we learned about healthcare systems, global healthcare, and quality of care. Healthcare systems can be a crisis based on cost and quality of care. Healthcare economy has impacted by the introduction of healthcare reform. With profit levels on a decrease, there is a speculations that quality may be sacrificed as providers begin to retire early and at the time where they really need providers. Exploring healthcare internationally to invest in our markets beyond nations and local markets to see what is offered. Improving healthcare quality will take some time and work. Change has hospitals and providers looking for an efficient process that will renew quality of care at a much lower price. Things are changing the way insurance pay, and the hospitals have to change the way they bill. Thanks. That's a summary of all 6 weeks of what we learned. Thank you.